Okay, I'm going to go over how to implant plan using a generic tooth inside Romexis. Now, a word of caution, using a generic tooth means that you don't get occlusal data when you plan this tooth. You get an idea, but it's not definitive. The best way to do that is to go into CEREC and put your scans in and then do what is called prosthetic planning, or you can even just place a tooth in a position of where that space is, draw your own margin, and plan the tooth to see where the occlusal forces are relative to the opposing dentition. Again, we want to do this implant planning with the occlusal data in mind. We also want to do the implant planning because you have to be understanding of what you need to do or accomplish to get this implant into position. Not every patient can have an implant, right? Some patients need surgical intervention before they get the implant, i.e. GBR. Some patients just don't have the bone, or maybe they need a sinus lift. Maybe they need ridge splits. You want to work through this implant planning with the knowledge that at the end, you know exactly what you're trying to achieve for the patient, so they know what they can and cannot have. You don't want to make the reliance on the lab. The lab are not clinicians. They're lab techs. They'll give you their opinion, but their opinion has no value. The only value is you approving it. If you approve it and it's wrong, then it falls on you. So take time, understand the implant planning process. It's not a check mark. It's not a checkbox. In your practice, it's going to be what you sign off on. Okay? So let's go through this case. So we have an implant that needs to be placed at number 3. Now, I want to use this workflow for a generic crown just to improve or increase the efficiency in which you can get these planned and shown to your CCC, and then also for scheduling. Right now you guys have to send it to in-house lab. They do a wax up. They show it to you. If you don't like it, you go back and forth. So it's better that you understand what your patient needs, then plan it with the generic tooth. Now, going forward, we're looking for options to have a proper implant planning software that does all this, especially in the Sirona CEREC environment. But right now, we're not there yet. So this will be the more efficient workflow. Okay, so let's start. We have a CBCT right here. And so what we're going to do is we're going to stitch the upper and lower models together, the scans, and then plan a tooth and plan an implant. Okay, first things first, you're in Explore. What you're going to do is you're going to come over here to the tools, Fit 3D, Model Scan, right? When you do that, you're going to go into your STL drive on the end cap where you put your CEREC scans, and you're going to go find that. Now, you'll be in an STL drive. I just put them on my desktop. So I'm going to go into upper jaw. I'm going to stitch the upper jaw. So wherever the implant is going, that's where you start first. If you're going to do upper and lower, I'll tell you what to do coming up, but let's just start. We have an upper jaw. We're going to add it. Upper implant, we're going to add the upper jaw first. Minimal points you need are 3 to stitch. Scroll here real quick. Over here on the right is threshold. Threshold basically cleans up the model. If you bring the threshold down, you're going to see tissue. If you bring it up, you're going to get as much out of the way as possible. I take this till it turns just a slightly blue color, and that gives me enough detail for me to find stitch points. What I want to do is find stitch points that will allow this to articulate correctly. So the first things first, let's take a look at this guy right here. I'm going to use the cuss tip of the canine. I'm going to go around here. I'm going to use the distal of the incisor, central incisor right there. And then I'm going to go over on this side, and I think I'll use the cuss tip of the premolar. Now, you can use more points if you want. If you thought, well, you know what, I can come in here and add another point, you could. Let's go right here to the buccal groove, and we'll add the buccal groove. Sometimes it throws it off and it doesn't give it perfectly, but let's start there. You're going to hit done. It's going to process and use what's called a matching. Okay, matching is done. The green looks pretty spot on. We're going to use automatic match to fine tune it and stitch it all together. The next step is confirming that the stitch is right. Okay, Now what you want to do is you want to kind of zoom in here. You want to take a look at this blue line. This blue line represents your scan relative to the CBCT. You want to make sure that this is accurate. If this is inaccurate, any surgical guide that they make, especially if you're doing it in-house, will not fit. Outside labs will notice the discrepancy and tell you to take a new scan. So you want to confirm that that looks like it's intimately connected to the scans to the CBCT, which they are. Okay. Now, over here on the right, you're going to see the object browser. Every time you fit a material, it goes down here to the object browser. Now, there are things you can do down here. You can change angles. I wouldn't do anything. You can move things. I wouldn't do any of that. The only thing I really would do is change the color. That way you have a good idea of what you're looking at any given time. The yellow I'm going to use for the upper, and then I'm going to move forward. Okay. Now, the next step is putting the lower scan in. Now, there's two ways you can do this. You can attach the lower scan to the CBCT, but that really doesn't tell you anything. You want to bring this in as a group. You want this to be articulating with the upper scan. So what you're going to want to do is go back to fit, go back to your STL drive, find the lower jaw. When you pull it in, you're going to see two options, right? Use existing match or do new match. You're actually going to do existing match. The existing match pulls the scan to the occlusion of the scan that you did in CEREC. If you do new match, you have to find 3 points on the lower and stitch them, but that really doesn't tell you anything. So once I hit use existing match, it's actually going to pull it up against the articulated model of the upper. Okay, now you can see what I'm talking about. The lower scan pulled itself up to the occlusion of the upper. This is why it's important to verify your occlusion before you do this. Really attaching this lower to the lower scan really does nothing for you. There is also the thing that the jaw's kind of in the way, right? You turn it on and off by these little eyeballs over here, but this jaw's in the way. So the best way to do that is go to this eraser tool or clean rendering. Then you're going to basically go down here and you're going to erase the lower jaw on the rendering. This is going to help you see the upper a little bit better and through the planning. Don't worry, you can always bring it back by hitting that revert button right here. So now that we got it out of the way, if you want to get any of this other data out of here, see that. If you ever mess up, just go back and hit revert. Okay. So now we have the upper and lower in articulation. Now that won't erase what you see over here on the image. It's just helping you see it from this angle. So if you want to take off the lower, you just hit that button and it goes away. Okay. Let's put it back on. Okay. So now we have that. We're going to go on to, let's see, anything else I want to show you on here. Really nothing on this. Let's go to panoramic. Now, the panoramic curve is basically this green line that goes around. Now, you can do the whole arch. You can do half the arch. Sometimes it's nice to do the half the arch so you're not looking at everything. To me, it doesn't usually affect me, but I'll show you how to do that. And then do curve again. Now just stay in the bone. So now that's all you need to see. I'm fine with the full pan, so I usually just turn on super pan, and now you have the whole panoramic. It doesn't really bother me whether or not I have a small portion or big portion. Okay, now we're going to go on to placing an implant or placing the generic tooth in the implant. So we're going to go hit next on the implants. Now we're going to look at where we want to place the implant. So here's this little red slider right here. We can just grab it and we can move this over. And now that's situated basically right in the middle of where that implant roughly is going to go. Now you can see the opposing occlusal data that we brought in that's articulating with the upper. If you had this attached to the lower, it really wouldn't help you at all. Okay? But always remember, you still don't get occlusal data even by doing this. That's why you'd want to go back to CEREC and at least plan it in that plane. Okay, so what we got, let's go down here to implant. Let's go And here's the implant library. The implant library is going to have the Bicon, Dio, and Straumann libraries. We're going to use Bicon or Dio. Most often, Dio is probably our 80 to 90% used system. So if you open that up, you're going to see a list of the Dios that we have. We use the UF2 line, so you're always going to stay within this line right here. And then the Bicon is usually going to be the Max 2.5 or the short, those kinds of things. So, okay, but before we do that, I'm going to come down here to crown. I'm going to add a generic crown. So I'm going to hit tooth number 3, since that's what we're going to do. I'm going to hit add to plan, and I'm going to walk it right over here to where this is. You can put it in this field. You can put it in this field. You know what? Let's put it in this field so you can see it. So now we're going to drop the crown in. Now, over here, you go down to Object Browser and make it smaller. Now you can actually see the crown. Now, in this view, you have the tools to move the crown into space. So you can do it in here as well, but it just doesn't have the smaller shape. Remember, with implant crowns, we're always a smaller occlusal table. If you want to get rid of the upper, now you can see that one as well. If you're like, hey, where'd that go? So I'm going to make that fit the space. Now I'm going to tilt it a little bit so it's in that same plane that I want it in. And if I add the lower back in, now I can see where the occlusion is hitting. And even you can see the occlusion coming through. But again, this isn't the definitive occlusion. Obviously, you have a slightly flatter tooth down here, and this is heavily anatomized. So again, not 100%. So you always want to verify in CEREC before you do this. So, okay, so I'm just going to move this into place. And actually, it looks pretty good. We're going to go with that. I'll put the lower on just so we can see where it is. So now we want to actually go to the next step, which is planning the implant. But before we begin, let's just take a look at this guy right here. Now, looking at where this implant is, and maybe you're like, well, we can make that a little bit smaller, fit the area. Okay. But if you can kind of see where we're located relative to the buccal plate, there's not a lot of room there. And you know that you have the sinus. So there's a couple things that stick out. Yay, we're going to need to do a sinus lift. Okay. B, what about this buccal bone? Is it thick enough to accommodate the implant that we're trying to put in there? This is why it's important for you to do the implant planning. Because yes, the lab can tell you that, but you should already know this, right? Doctor, you're making these decisions, not the lab. So instead of wasting time and planning and going down the line, this would be a conversation with your surgeon about doing a GBR, as would this case be as well. So that's why it's important for you to do and learn implant planning. Okay, so what I'm going to do is I'm going to come over here to the library. I'm going to click on that. I'm going to go over to implants. Now you have the abutments you can attach to it. You got the fixation pins. These you are rarely ever going to use. So you're going to go to implants. You're going to go to Dio. You're going to go to UF2. We're going to go with a regular first. And you know what? I'm going to throw a big 5.0 in there with 8.5. So we're going to drop that in place. Now when you place this in, if you're doing this manually like I'm doing, it's going to put it in upside down. And you just have to grab it and turn it all the way around so it's in line. And now it's in line with where we want to place that implant. So now you can see that the buccal plate is thin relative to the implant. The lingual looks pretty good. In terms of the width, if we go down here and hide that upper, we can see, well, we got plenty of width. So we got plenty of width, but we don't have the we have plenty of length, but we don't have the width. So this is the discussion that you're going to have with the surgeons about the need for GBR if we want the proper implant to be centered over the correct axis of the occlusion. That's why it's important to know these things. Okay, so we're going to put the the lower back on, and now you can actually see where that tooth is hitting the center of that tooth. It's relatively close to this buccal right here. So if we really wanted it accurate, we would have to move that out just a little bit. And there it is. Now you can see the thin buccal plate. Now you can go to a smaller implant, but it's still, even if we double click, hit the library, and we go down to 4.5, you're still in that same need-based system. So, actually I didn't do it. Hold on. So a little bit what I did. I'll show you what I did. Let's put that there. All right. To delete something, you're going to highlight it and look for the garbage can. But just so you know, each browser group has its own garbage can. So you can't click this, hit this garbage can, I'll delete. So I'm going to hit this one, and then I'll come to this garbage can. I'll just confirm delete. It'll go away. So what I did was, if you double click on it, you go back to this, and you go, you know what? I'm going to go back up to that 4, 5 by 8.5. I hit add to plan, but really what we want to do is replace. So we're going to hit replace, and now it replaces it. But even so, even replacing it, the smaller, thinner the implant still will require some type of augmentation on that buccal to be successful for you. Okay, one little tool that's really helpful to see that is what's called implant-centric view. You can capture it here where it looks like it's within this little sniper scope, or actually hit this button here. So if you hit that, now you're going to see basically relative closeness to the buccal plate, how it looks in the sectional view, and basically everything looks good. It's just very close. As you come up, you can see now the buccal plate drops in and really close to that, which would cause some recession in the area and not favorable outcomes. So always good to really evaluate in this implant-centric view. Okay, so that is how to plan a generic implant crown and the implant in Romexis. Again, not giving you any occlusal data besides what you can find out before planning the implant in CEREC. So this will help kind of expedite or make more efficient the planning portion of it. This is what you'd be presenting to your faculty with the CEREC scans and the occlusion, just so to move forward with the case. Now, one last little comment. You're going to say, well, Doc, what if I'm planning an upper and lower implant? How would I bring the files in? What I would do is I'd bring the files in together similar to this. However, if you were doing an upper on 3 and a lower on 30, you'd have to bring the upper in attached to the CBCT. You'd have to bring the lower attached to the CBCT. And then you would also have to bring the upper and lower again in an articulated fashion as well. So you'd be doing things technically 4 scans. So right now I just have the upper matching to lower, but if you had upper and lower, you definitely want the upper and lower in the CBCT plane, but then also bring in the other 2 again in articulation, so you know. Okay. Hopefully that helps. If you have any questions, come see me in my office, talk to one of the surgeons. Once you're done with this is when you would be talking to your CCC about planning the implant and getting approval for your consult with the surgeons, whether it be a GBR or a implant placement. Okay, thanks again for listening, and come see me if you have any questions.